Hi, guys. Welcome back for our daily practice questions. It is day 12, but as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. All right, question number one states a 32-year-old woman presents to the clinic with a 2-day history of right ear pain, a feeling of fullness in the ear, and some mild hearing loss. She also mentions that she has had a low-grade fever and congestion over the past few days. On physical exam, you notice redness and bulging of the right tympanic membrane. The left ear appears normal. What is the most likely diagnosis? Is it A, acute otitis media, B, chronic otitis media, C, otitis externa, or D, no diagnosis at this time, continue to monitor? Take a moment and tell me what you got in the comments, you guys. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you are answering what is even being asked of you, right? So here the stem of the question states, what is the most likely diagnosis? And y'all know I tell you, if they're asking for a diagnosis, you need to run it back and look at the assessment findings. Paying attention to their signs, their symptoms, how they present, what is their chief complaint, what is noted on the exam, and pay attention also to their age, their gender, and ethnicity if that is provided as well, okay? So we have a 32-year-old female. She comes in, she has a 2-day history of right ear pain, fullness in the ear, and some mild hearing loss. She mentions a low-grade fever and some congestion over the past few days, but on exam, you note redness and bulging of that right tympanic membrane. Now, y'all, that is classic presentation of A, right? Otitis media, acute otitis media at that. Remember, I tell y'all to think about your medical terms. That inflammation and that redness with itis means inflammation, right? So redness, bulging, and media being that middle portion, so that tympanic membrane, right? So A is your best answer. All right, question number two. A 45-year-old male with a history of seasonal allergies presents with a 3-day history of ear pain, fever, and fullness in his right ear. He also reports occasional dizziness and a sensation of imbalance. After confirming the diagnosis of acute otitis media, you are planning to initiate treatment. What is the most appropriate first line treatment for this patient? Is it A, amoxicillin, B, Cipro eardrops, C, oral prednisone, or D, acetaminophen and watchful waiting? Take a moment and tell me what you got. All right, all right, all right. Stem of the question states, what is the most appropriate first line treatment for this patient? Remember, if they're asking you for treatment, you need to run it back and see if the diagnosis has been provided. If the diagnosis has not been provided in the scenario, you need to run it back a step further and work from the top, right? Looking at those assessment findings and working your way through, because you got to know what it is to be able to treat it, right? So here they have not provided the diagnosis, so we need to figure out what the diagnosis is and then determine how we would do first line management for that, right? What is that first line therapy for that diagnosis? So we have this 45-year-old male. He has seasonal allergies, had a 3-day history of ear pain. He has fever and fullness in his right ear. He's starting to have some dizziness and imbalance. We know this can be associated with ear issues. So let's see what's going on. After confirming the diagnosis of acute otitis media, you are planning to initiate treatment. And look, y'all, the diagnosis isn't this. I don't know why I'm thinking of question one, but it's acute otitis media. But even if we're working through the assessment findings, since I took y'all all the way back there, let's do it. So we have the allergies, we have that 3-day history, that fever, that fullness in the right ear, It's presenting like acute otitis media, right? But it has been confirmed. So, how do you treat acute otitis media, and what is that first line therapy for acute otitis media? And your best answer choice is A, right? Amoxicillin. Remember, I tell y'all to think about the A's. Amoxicillin is first line therapy for acute otitis media. I had y'all working harder than you had to on that question, didn't I? All right. Now, question number three. A 28-year-old woman with a known penicillin allergy presents with ear pain, fever, and a history of cold like symptoms for the past 4 days. Upon exam, her tympanic membrane is bulging and erythematous, and she has diminished hearing in the affected ear. You diagnose acute otitis media. What is the most appropriate alternative treatment for this patient? Same thing. They're asking for treatment. So you need to determine if the diagnosis has been provided. I ain't gonna make y'all work that hard. The diagnosis has been provided. We have acute otitis media, right? All right. And so now it's asking for the most appropriate alternative treatment. So you need to think about, why do we need an alternate treatment? But let's think about what we just talked about. What is the first line therapy for acute otitis media? It's amoxicillin, right? Well, this patient has a known penicillin allergy, so we know we can't give amoxicillin to this patient. So then we need to think of our next steps. Would you go A, azithromycin? Yes, azithromycin is the best answer choice, but I'm going to walk you through the other ones first. B, augmentin, you know you wouldn't do, because augmentin is what? It's amoxicillin plus clavulanic acid. So you know it has a penicillin component, so you can't give that. Ceftriaxone, as I always tell y'all, penicillin and cephalosporins, sisters, cousins, they're family, right? So when you're allergic to one, you want to consider and treat the patient as if they're allergic to others. They're both beta lactams. You don't want to give the cephalosporin either. Bactrim is not utilized for the treatment of acute otitis media. So y'all, again, when I was just telling you on the last question, when I tell you Brittany's brilliance, think of the A's. A for acute otitis media. B, B. A for acute otitis media. A for amoxicillin as the first line therapy. Second line therapy is A, augmentin. But if they have a penicillin allergy, you use A, zithromycin, right? So think of the A. So if you do any of my review videos, or if you have any of my books or flashcards, you'll see that I have that included under the Brittany's Brilliance. But as you study it, I want you to think of those A's, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number, or shoot us an email to the Nursing Studio, the number one, at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. But as always, if you're looking to book a one-on-one session or any of my custom packages or plans, I say to either call, text, or email so that I can gauge what you truly need to make sure you're booking the appropriate session types. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.